More than 7,000 people in Mongolia are diagnosed with cancer annually, with liver cancer accounting for nearly 40% of these cases. Research shows that Mongolia leads the world in liver cancer-related deaths. Medical experts attribute this to many patients seeking medical attention only when their cancer is at an advanced stage, significantly reducing their chances of survival. Physicians at the National Cancer Center are diligently working to implement the latest treatments effectively. Liver cancer accounts for 33.2% of all cancer cases in Mongolia. As of 2022, 4,548 people in Mongolia have died from liver cancer. For every 100,000 people in Mongolia, 100 people die from liver cancer. A recent study indicates that more than 400,000 people in Mongolia have been diagnosed with hepatitis B and C virus infections. Medical experts say that liver transplant surgery in Mongolia is a complex procedure that lasts 10 to 12 hours. They warn that it is crucial for people to undergo early diagnosis and receive treatment to prevent death from this disease.
Numerous factors contribute to the development of hepatitis B, C, and D infections, including alcohol consumption and various metabolic conditions. This prevalence is particularly high in Mongolia due to multiple risk factors. The incidence of cancer is also elevated in individuals over 40 years old, which is closely linked to the high prevalence of hepatitis B and C in the Mongolian population, within hospital environments and across Mongolia.
Many advanced technologies have emerged for treating late-stage liver cancer, and Mongolian doctors are actively localizing these innovations. There are several treatment options available for tumors ranging from 2 to 5 centimeters, including targeted therapy, immunotherapy, and chemotherapy. Liver transplants are often recommended for patients with tumors larger than 5 centimeters. Doctors are also exploring the use of 3D technology in surgical procedures, drawing from international experiences and expertise.
When dealing with early tumors smaller than 3 centimeters, our angiography team can achieve complete remission and avoid surgery by inserting a needle into the liver and ablating the tumor. This approach allows patients to resume normal life swiftly post-operation, avoiding scars and prolonged hospital stays.
I am a liver and hepatobiliary as well as liver transplant surgeons in New York, and I'm here on behalf of the Virtue Foundation, which is a nonprofit organization in New York that has done many surgical missions in 25 countries. I'm here representing the liver hepatobiliary team. And it's been an honor that I was invited here for my second trip here, mission trip in Mongolia, where I'm been working with Dr. Unenbat and have been experiencing his his service here. Mongolia, as you know, is one of the leading countries in HCC because of hepatitis. And it's been a pleasure being back here, and essentially what the team has done are performing now since 2018 living donor liver transplantation, and they are probably aiming to do around 70 cases this year on living donation. And today I had the privilege to assist on one of the cases that is ongoing right now. It's a living donor transplant in a patient who has hepatocellular carcinoma that was treated and now is undergoing transplantation.
What would you say about the development of Mongolia's these cancer centers, maybe equipment or the ability of doctors, maybe? When did you arrive here for the first time? Is there any development?
Yeah, so I've been here for a little bit over 10 years ago, and I must say Already back then, the surgeons were very advanced, but transplantation was not part of their program, and this initiated in 2018. And I have to say, comparing my experience to the experience that I had over 10 years ago, I think the surgeons have really rapidly evolved in their techniques and are is a great team player, a wonderful nursing staff and help. And I think it's been a humbling experience for me to compare what we do in the U.S. and here. And I must say that there have been terrific surgeons, and Dr. Unenbad has done a terrific job of pushing his team forward and having very comparable results to many countries that have started, living donation way ahead of him.
Doctors and nurses at the National Cancer Center have highlighted the positive impact of national programs initiated by the Mongolian government to expand access to treatment services for a larger segment of the population. More initiatives are expected to facilitate easier access to treatment services with health insurance coverage.